The virus is out of control. The NHS is at risk of being overwhelmed. What I mean by that is that we're at risk of the NHS hospitals running out of beds over the course of the next couple of weeks if the virus continues to spread and people continue to be hospitalised. You'll be aware that across the country, on average, 1 out of 50 people have this virus. In London, on average, it's 1 out of 30. In parts of London, it's 1 out of 20. The ambulance service in London does an amazing job. On average, they would respond to 5,000 calls a day on a busy day. They're responding to between 8,000 and 9,000 calls a day. So we've already diverted some of our firefighters to drive ambulances. And over the course of the next few days, police officers will begin driving ambulances as well. We have a situation in London where the numbers of patients in our hospitals with COVID is 35% more now than it was during the peak in spring. Yet the restrictions in London are less serious now than they were in spring. So there is a number of things we've got to do. Firstly, I'm calling on the Prime Minister, and I've written to Boris Johnson earlier today, to stop, for example, collective acts of worship in London, which can still occur. I deliberately missed Friday prayers today, but Friday prayers are still taking place. Churches, gurdwaras, temples are still open. Also, it's really important that we accelerate the rollout of the vaccine in those parts of London where the virus is spreading incredibly fast. We also need to make sure that we provide additional financial support to those Londoners who need to self-isolate. We've got this ridiculous situation where Londoners who should be self-isolating, because they're on a 0 hours contract that don't get sufficient support from the government, they're going out to work because they need to work to get money to put food on the table and a roof over their head, and are inadvertently either passing the virus on or cashing it. So we need a number of steps from the government to assist us, and me declaring a major incident, I'm hoping, makes it easier rather than harder. But secondly, it's a message to Londoners. You all need to understand this is serious. I've never been more concerned than I am now. The best way we can help our stressed, our strained, and our stretched NHS staff and our hospitals is by staying at home unless you have a good reason to leave. And if you do have to leave home, please wear a face mask.